So I think this course is very well worth it.
He knows a lot.
Simplifies the technique so much.
His cases that he does honestly sounded a bit too good to be true, so I wanted to see it in action.
Even with experience and knowledge, many doctors still feel insecure when performing full arch surgeries. When it's time to decide it, to intervene and to take full control, common questions arise. Is my planning correct? Do I really have the technique required to perform the surgery? Will I achieve consistent and excellent results? If you identify yourself with these questions and you are starting in this world of full arch, or you are an experienced doctor and want to see full arch in a different perspective and be more efficient, this is for you. Gathering 23 years of experience, I will show you what we do on our daily basis, what works and what doesn't work. In a few days, you're gonna grow more than 10 years alone in your clinic. Actually, I wish I had this training and this continuous support 20 years ago. I would evolve much faster and make my life easier. Here you learn how to master the traditional all-on-4, but also learn advanced techniques and understand how to push the limits to solve complex cases without zygomas. The clinical residence was created precisely for that. A practical, intensive experience that puts you at the center of the action. 101, where I'll be supporting you and holding your hand all the time. Here, you learn by doing. You have the theory, you plan, assist and perform full arch surgeries on real patients under my direct supervision and support. You will also benefit from the guidance of my team to every stage. During this clinical residence, you will learn how to master techniques such as palatal approach, pterygoids, transinusal implant, M technique, V technique, and how to manage the golden triangle, applying them with predictability and confidence, but also advanced techniques. Beside the surgery with all this importance, we're gonna focus on the prosthetic workflow. What matters? Actually, this is what the patient wants. And we're gonna cover the analog workflow and the digital workflow. That way, we're gonna choose what is best for your own reality.
This clinical residence is about these details, so you can observe, you decide the theory, and then you're gonna execute.
I've been to some other courses where they have that same attention to detail, but it's different when it comes to full arch. He has a system here that has been refined and I think really honed and perfected that I've not seen in any other full arch situation. So I'm super excited about how everything's turned out.
So having the lab in-house has been really good because it's not just about the surgery and placing the implants, but it's also about, seeing what happens next, how the labs get all the information and correlate it together to make this beautiful prosthesis.
Now I can see it can definitely be done, because previously I'd be doing standard all-on-4 cases. Anything too complex, very thin ridges, I would be referring to the oral surgeon for zygomatic implants. But Pedro has been able to bypass that with his palatal approach, and I think that's pretty amazing. And now I can go back to Melbourne, tackling those very difficult cases with the technique that is taught me.
More than 1,500 doctors worldwide have already taken part in this experience and completely transformed the way they approach full arch cases. Join the Full Arch Plus clinical residence and discover what it truly means to master full arch surgeries. Turn complex cases into simple ones.